Matters. I'm your host, Karim Amiry. Over the past season of Health Matters, we've covered what employers are interested in right now, from mental health resources to customer experience and artificial intelligence. In this Best Of compilation, you'll hear the most insightful moments from our guests throughout the year. In our first episode of the year, I sat down with Julie Enga, team leader of employer consulting and well-being, to talk about employee health and wellness and the popularity of apps that help members live a healthy lifestyle. So let's dive in. Wellness apps generated $950 million in revenue in 2023, with North American users responsible for $355 million of those dollars spent. What do you think, or what do you know about what's driving that spend?
So I think both of us know that we're hearing from groups, we're hearing from members, we're all looking for that new resource, new tool to help us be healthy. So whether it's to help us sleep better, move more, you name it, there's usually a device, an app, or something that supports that. So I think it's a couple specific reasons. As people, we all want to be healthier. So number one, how can we be healthier? And we're looking for something to nudge us. Number two, employer groups are asking us at Wellmark, how can you help our members be healthier? So when you think about just in our market or who we have around us, lots of questions. So then you make that nationwide and you can understand why there's that high revenue and high utilization.
Yeah. I mean, especially think about foods to eat and when to eat, and tells you all that. Yeah, it's tracking everything. So that leads me to why you're here, the exciting news or the exciting reason for you to be here today. So what is Wellmark doing to address the need and provide additional wellness solutions? As you said, you've been asked about it by many employers and their employees.
Yeah. So well-being benefits are no longer just a nice to have. It's almost table stakes for our employer groups, and it is definitely something, as we said, individuals were looking for. And so when we took a step back and said, how's Wellmark helping our members manage their health and be healthier, we had an incredible opportunity to share a fully integrated platform with all of our members. You mentioned it, Wellmark Connect, powered by WebMD. So when you think about the brand strength behind that, both Wellmark, it's something that we use and we trust. And when people go to look for health and well-being information, they're going to WebMD as one of the top places they go to. So we actually rolled out Wellmark Connect to all members 18 or over recently. So it gives our members tools and resources to support their health. And all of this is through our My Wellmark site or app.
So now let's shift gears from wellness technology to a quickly evolving technology, artificial intelligence. I chatted with Wellmark Executive Vice President, Chief Information and Digital Officer, Paul Lifko, about how AI is being used today and what future possibilities could be. Talking about that core, and what are some examples of how AI is going to transform the healthcare industry, since that's what we're here to talk about?
Yeah, I mean, frankly, I think this is one of the most exciting aspects of AI is healthcare.
Yep.
A good one right now, imagine the best radiologist in the world looking at your imaging, right? It's not whoever's local necessarily.
Yep.
It is the best. So there are models that already sort through images at scale based on the best learnings, the best radiologists, and the best training. Is that going to replace all radiologists? Probably not. But it's going to allow them to scale their impact and serve more consumers or more patients. That's one example.
Okay.
Medicine coming into the home. And this is one I'm probably most excited about. Imagine a Wi-Fi-like device, and there's a company called Emerald that's experimenting with this, that can sit in your home, absorb all the electromagnetic signals that the human body gives off, and then turn those into actual diagnostic tests to detect like Alzheimer's early on, right?
Wow.
So you can treat things earlier. And that's just a simple example. Like I can see, like as the cost scales down and artificial intelligence gets closer to the edge, which is where most computing heads, like we're going to see more medicine localized and personalized in our home. And we're going to see more evenly distributed expertise in medicine, which is going to give people more access to services than they otherwise would have today.
Speaking about Wellmark specifically, what do you think you see as the benefits or usage at Wellmark?
When you think about generative AI, I think one thing that is a struggle for our industry in general is like we've learned a lexicon that is unique to healthcare, unique to health insurance that patients don't necessarily know. Right? So being able to interact in our industry with natural language and doing that translation when either you're looking at your benefits or you're understanding claim details or you're approaching finding the right provider for X service, like using your natural language and being able to translate that into industry jargon that's been in existence for decades will ease the burden of kind of the translation that many patients or consumers or our members go through. Just speeding up the industry in total.
Yeah.
Right. So a lot of what happens in healthcare in general is wait times, lag times, and the more real time we can make certain processes by bringing artificial intelligence in for either traditional automation or making automated decisions that speed up access to care. As a simple example, like we already have real-time decisions on over half of those access to care decisions. And with artificial intelligence, we might be able to fast track even more of those approvals.
From innovation to navigation, Tyler Elliott, Medicare Group Consultant, gave us tips to guide your employees through Medicare step by step. So I know first on your list, you have enrollment timelines. I know there's key time frames that members need to be aware of. For me, I'm always trying to remember what those are, not only for those enrollment purposes, but to avoid penalties. They can be pretty substantial. Please tell us a little bit more about each of those.
Yeah, so enrollment timelines are important because, as you mentioned, it could lead to a late enrollment penalty if they don't get enrolled at the right time for themselves. And I say for themselves because everyone has their own unique situation. And again, if you don't get enrolled at the right time, it could lead to a gap in coverage or lead to a late enrollment penalty. So I'll kind of break this down into two buckets. Those that will be going on to Medicare at 65, and then those that might want to continue to work and stay on the group health plan.
Which for a lot of people, that's more and more the case.
More and more people are deciding to work past 65 and stay on their group health plan. So starting out with those that would retire at 65 or decide to go on to Medicare at 65. They have what they call the initial enrollment period. So as an employer listening to this, if you had somebody that came to you and said, hey, I'm going to retire at 65, what are my options? This would be that enrollment period they could utilize to go on to Medicare. So it's a 7-month window, starts 3 months before their 65th birthday, includes the month of their 65th birthday, and then will last for 3 months after their 65th birthday. Okay. Now, like we talked about, those that want to work past 65 and maybe stay on the group health plan. Yep. We get that question all the time. Do I have to go on to Medicare at 65? Can I stay on the group health plan? You can do that.
Yeah.
That's the short answer, right? It is something that you can do. The key to that is ensuring that you have creditable coverage.
Yes.
Most employers do offer creditable coverage, and essentially what that means is the coverage they offer is just as good, if not better, than what Medicare offers. So if you are someone that wants to continue working, continue on the group plan, just ensure you have that creditable coverage. You can continue to work and delay going on to Medicare and not have to worry about a gap in coverage or some sort of late enrollment penalty that could come.
In this next episode, I sat with Becky Brinker, Director of Operations, and Mary Weber, Customer Service Performance Champion, to talk about how our customer experience team is doing more to provide first call resolution and eliminate extra work for the member. But if you want to talk about the approach and how you engage members and how we achieve this goal that we want to provide to them on really taking them out of the middle.
Maybe making an outreach call to a provider office, providing insurance information. We've had a couple recent examples where we needed to have newborns, babies, claims filed to us. So members were getting billed, but we hadn't received the claims. So we were able to call those providers and have the claims submitted. Those are huge wins, and it gives us the opportunity to take care of it and to say, hey, I talked to Jane at your provider's office and they're going to submit that claim to us. And then, the member, it gives them peace. And you can really hear in their voices the appreciation that they have.
as a member's on that call, let's say prior to March to now, what looks different? What is the feel for the member as they're now in this new approach from Wellmark?
That's a great question. It really is about not saying to a member, this is what you need to do, but more so, this is what I'd be happy to do, and taking them out of that space. It's a difference between a member calling a provider's office and trying to figure out how to navigate the words, the pieces, the data, and our CXAs, those representatives of Wellmark as a whole in our business and how we take care of people calling that provider's office and taking care of it, letting the member know, I talked to that provider. So we're hoping that the members aren't necessarily getting all the specific, A to Z pieces, more so this is what I'll do, this is what I'd be happy to do, I'll take care of it, and I'll give you a call back on Wednesday with the outcome of that conversation. So really, less is more for our members and just handling it.
I love how you phrase that as this is what you have to do to this is what I'll do for you, or this is what I can do. Mental health is always an important topic, and it continues to have major impacts for members and employers. I chatted with Donna Rackley, Director of Health Services Case Management, about how our behavioral health case management team is providing assistance to members to get them to the right level of care. Last time when we had a conversation about mental health on the podcast, as I mentioned, Cami and Dr. Stanley were with us, and we were talking about some enhancements that Wellmark was actually launching last May, and you are leading that team, which is part of that enhancement. If you wouldn't mind giving us an update on that behavioral health team and some of the things that we're doing today.
Certainly. I think before I start, I'd like to kind of level set around case management and
that
what
would be
that
great.
is.
Yeah, that does confuse people sometimes. What does that mean, and how does that fit in with all the services that are offered to our members?
Exactly. So case management's available to all of our members. We're there to support members as they have their health journey. We use claims and other data to identify members that might have gaps in care or have other chronic health conditions that we could help. We also get referrals from, it could be from customer service, it could be from your provider, it could be from your account manager, or your HR team could make that referral on your behalf. And then once we receive it, we'll a case manager from our team, that could be a social worker or a registered nurse that is aligned with the program, will outreach to that member and do an assessment to understand what their care needs are, and then work with them to develop an individualized care plan. And that'll begin their journey together to help support their healthcare needs. So that's kind of high level what our case management program entails.
Yeah, thanks for sharing that. So when we talk about the behavioral health team that you lead, how's that different than case management that's offered?
So our general case management is focused more on medical conditions, and we saw an increasing need and more individuals that just needed that behavioral health, mental health support. And we decided to stand up the case management program, as you referenced, in 2024. So we've expanded that team. We now have 10 behavioral health social workers and registered nurses. They all have an extensive experience and background in behavioral health, anything from children, adolescents, through adults and seniors, and they're there to support that team. Additionally, we added a behavioral health team leader that's focused on leading that team, and a medical director, Dr. Stanley, that you have interviewed previously on the podcast.
Yep. So the intention of the team, if you want to talk about like what is the intention, what is the hoped outcomes for them?
So the outcomes, we want to help that member understand their condition, be able to collaborate with them on a plan of care, and that plan is highly individualized. So whatever condition that member is working on or focused on, it could be a mood disorder, it could be anxiety, it could be depression, eating disorder, it could be substance use disorder, the whole gamut of conditions. We will support that member, we'll help them find providers, we'll additionally help them navigate the system as far as right level of care, right kind of provider. We'll support them with that plan of care, understanding their medications and adhering to them, helping them understand what that plan of care is that their provider has worked with them on, making sure they understand the plan of care and know how to implement it within their lives to help have better outcomes.
Thank you for tuning in to this best of episode of Health Matters. We hope you find the information valuable and insightful. If you'd like to watch any of the full episodes, visit the Wellmark YouTube channel. We'll see you next time.